A very warm welcome to all of you to Ayurvedic Healing and Beyond podcast, and this is your host, Dr. Vignesh Devraj. In today's episode, we're going to briefly touch upon the importance of gut health and why we are having so many gut health issues. Why is gut health important in the first place? And what can you do in your daily activities that can help you? At the same time, please do check with a qualified healthcare practitioner so that you get the right advice. And whatever I'm speaking today, it's more for your awareness and information, and so that we are just putting seeds on what is healthy living. But it is very important that you consult a qualified healthcare practitioner so you get the right, specified, customized advice. Now let's understand, why is gut health important? So the reason why gut health is important, especially in Ayurvedic medicine, we say that however you digest, it's going to be a reflection of it's the mirror of your health. It's how you digest is very important. So sometimes, we talk about it's not what you eat that matters, it's how you digest that matters. Digestion, sometimes if your digestion is weak, even if you eat the most healthiest food or the so-called healthiest food, whichever the best nutritionist comes and tells you, if your digestion is very poor, even the most healthiest food can turn out to be quite poisonous. But what I'm trying to tell you is the importance of digestion over the food. Of course, the quality of the macro and micronutrients of the food you consume is also important. But it's in the end, it's the quality of your digestion that really matters. Followed with the kind of food, the quality of food, and how you eat, what you eat, the time when you eat, and are you eating very quickly or slowly? All of this matters. So digestion plays a very important role. So if your digestion is really good, even if you eat something quite unhealthy, your body can tolerate to some extent. And I always say my definition of health in today's world is, if you're healthy means your tolerance level for unhealthy things is very high. But after some time, when the tolerance level goes low, that is when your immunity is low, or you get sick very quickly, or you have more allergies, or your body's response is very severe and not so healthy. So when you say my tolerance level is very high for unhealthy things, somewhere your resilience and your body's health vitality is very high. So now let's talk about what makes the gut health very good. Gut is the place, if you look at the anatomical description of the word gut, it's also called as GIT, gastrointestinal tract, starting with the tongue till the end part of your intestine, which is the rectum and the anus. So the food, what you're consuming, passes through this entire channel, and all the nutrients in your food is absorbed into the body, and the waste needs to be eliminated. This is what is digestion. There is a funny definition of digestion in Indian language. Your digestion is something that you start with your right hand and end with your left hand. It's a very funny way of describing, but the idea is the whole process of digestion is what happens in your gut. And gut health really matters, because how you digest is how your health is. Now, we talk about, how important the quality of water is in your home. Sometimes when the water quality is not good, it can impact the entire livelihood of everyone. So, especially if you live in a home where you have a tank where it stores the water, and from the tank, the water is distributed to different pipes, and then you can, for bathing, for gardening, for cooking, for drinking, many different pipes will be distributed. But what if the tank is dirty? Then the water will also get contaminated, and the whole home will have dirty water, or water that is not safe to consume. So the quality and the hygiene of the tank is very important. That's why in some homes where you have a storage tank where you store all the water from, maybe you pump it up from a well or from a pond or a river, and then it stores in the storage tank, and from the storage tank it is distributed to different parts. But if the storage tank is not hygienic, it is not clean, this can contaminate the water, and the water can create all the problems in the rest of the home. So cleaning and keeping the hygiene of the tank is paramount for a healthy utility of the water. The same way, the quality of your gut and your digestion is paramount for the energy of your body. So sometimes when people complain, after eating food, I feel very tired, bloated, heavy, that means your digestion needs an upgrade. It needs to be improved or enhanced. So in Ayurveda, we have this concept of dhatu. Dhatu are the tissue elements that protects your body. So the food I eat, it blends with the enzymes and it breaks down into blood And from blood, the different nutrients go to different parts of the body. And it is used, and whatever is the nutrient, whatever are the food that is not the nutrient, that is not used for the body, will be eliminated as the waste. So when the food is absorbed, this process of absorption in Ayurveda, when it is not absorbed properly and if it stays in the body undigested, we call it as ama. There is also a word for ama, it's called ama. A means not, ma means me. Like arogya. Roga means disease, arogya means state of no disease. So whatever you're consuming, if the body is not able to break down the food into good nutrients your body can absorb, if that process is not happening, you pile up a lot of ama in your body. And having more and more of ama, it's like having more clutter in your home. They say having more clutter means you're not able to make decisions and everything has a designated space. And when you're not keeping things in the designated space, there will be clutter, and more clutter means there is more chaos and there is no clarity at home. Same way, when you have more undigested food in your body, this leads to a lot of unhealthy energy. It leads to a lot of outlets which can lead to a lot of energy leakages. So that's why in Ayurveda, having a robust digestion is paramount for your vitality, for your immunity, for your energy levels, for your thinking, for your emotions, and for your longevity. So that's why gut health is very important in Ayurveda. And one of the ways to identify how good is your gut health is to see how good is your hunger levels. Now, there is this two school of thought that says you have to eat on time or you have to eat only when you feel hungry. These are the two thoughts that we keep hearing. But if you deeply try to understand what Ayurveda says, it says you should get hungry on time and then eat on time. So that ability to be hungry on time plays an important role. Now, how does people get hungry on time? When they eat right with a schedule. And at the same time, whatever they are eating, it is good enough that they will be hungry for the next meal. But sometimes if you eat something very heavy to digest and if it is not processed properly, maybe you don't get hunger for a very long period. Sometimes I see patients coming with allergies, and when I look at their history, medical history, okay, when did this start? They might say, after I moved to a new city, or after I moved to a hostel, or I had to go for my college education and I was staying in a hostel. And then somewhere I started eating a lot of junk food and late night eating, and this will lead to a lot of other problems. So somewhere we need to see when the schedule of how you eat changes, it will always have an impact on your health for a good reason or for a bad thing. So if you're eating on time, it will have a good impact on your health. If you're not eating on time, it will somehow show up on your health. So that's why now we have a lot of studies which claims eating early, like 3 to 4 hours before you go to sleep, has a good impact on your restorative sleep. So the more late you eat, your restorative sleep is going to be compromised. And when your restorative sleep is going to be compromised, you wake up tired. And when you wake up tired, your cravings can go up and that cycle continues. So that's why in Ayurveda, being hungry on time and then eating on time plays a very important role in correcting many things. So recently I had a patient who's suffering with acidity. So one of the first questions we always ask when patients have acidity is, how long has this been happening? And maybe they're taking some antacids. And we always ask them, what are the kind of foods? Maybe if they're taking a lot of fried spicy food, and if they consume a lot of alcohol along with it, and if they're stressed with a lot of frustration and anger, all of this can combine and lead to acidity. Some of the times when people eat outside hotel food, this can also lead to acidity. Just by avoiding outside eating food, I've seen many people reverse their acidity problems just by eating good, healthy, home-cooked food. But sometimes the nature of the job of a person can be that they have to eat outside for a long time. Sometimes they eat a lot of junk food and they eat very quickly and they eat irregular timings. So we always try to correct, okay, first, can you eat slowly? Second, can you eat on time? And then can you choose the healthiest food? Even if you want to eat outside, see, maybe there is some way you can find the easiest and the healthiest food that you can consume. Maybe minimize spicy fried food. That is like, maybe sometimes some hotels, we don't know how long the food is stored or how healthy it is cooked. So try to look at the reviews and see how the quality of food is. And after you eat the food, how do you feel? Do you feel heavy, bloated or tired, or you feel healthy and energetic? Most of the times, the restaurants that we go to eat, their focus is not on giving you health. Their purpose is to make sure you say, oh, the food was really tasty. A tasty food and healthy food if you can tick both in the food, fantastic. I mean, that's what we try to do in our retreats. However, usually what you see in current junk food world, the tasty food need not be healthy. And that's why some people, they try to taste be healthy. These are their new campaigns that you see today. But it need not be all the time right. So sometimes the tasty food need not be the healthiest. And usually there is a notion, because when people fall sick, they are made to eat some the rice soup or mashed potatoes or something that which is very easy to digest or healthy. And people have an association, oh, when I'm sick and I'm eating healthy food, that is not so good. Like the Pavlovian dog association, they tend to have this issue. So eating healthy food, and that if you can make it, if you can train your body and train your taste receptors to appreciate healthy food as tasty, that is the sweetest spot you can do. So we always have to be very cautious where we go to eat and what we eat. This is very important. It's like, some people are very cautious who they should let to come to their home. We are cautious, I don't want that person to enter their home because it might impact my energy of the home. Same way, your body is your home. You should be extremely cautious what you're letting it inside. Now, what I'm talking about is, if the food is contaminated, be very careful. Be very connected with your body's feeling after you eat. So this plays a very important role in their overall. Your ability to choose healthy food is one of the best talents you can have for your longevity. But if you're programmed in a way that I'm eating constantly unhealthy food, or you're surrounded by systems where you tend to eat unhealthy food, this can lead to a lot of problems that medicine can hardly have much of the recovery protocols here, because medicine cannot do much when it comes to unhealthy eating habits. There is a very limit what medicine can do, because maybe, okay, you have an acidity, you can take an antacid. You have a constipation, you can take a laxative, or you have a lot of other bloating issues. There are some medications in Ayurveda that can give you symptomatic relief. But the best therapy is always getting back to the root, which is eat on time, eat slowly, chew your food, and then eat healthy. Try to make sure that in Ayurveda, we didn't have the concept of calorific values when this was documented. So they always had to look at the taste and the result after you eat. So we have this concept called vipaka, which is after you eat, how do you feel? Do you feel heavy, bloated? Or there's after taste of the food, how do you feel? So if the food you eat, afterwards, if you're feeling energetic and if you're feeling light in the body, fantastic, that food is good. But the food you eat, you feel very tasty, you feel very good, you feel very satiated, sumptuous food. But afterwards, if you feel heavy, bloated and tired, not just immediately after a few hours, maybe for the next day also, you're feeling tired to get up in the morning, you need to change the content of your food. Maybe you need to focus on easy to digest, minimize the oiliness, minimize the fried food, minimize food that are longer in the shelf life. So there are various descriptions. Some of the thumb rules that I always tell them: eat less so that you have enough space. So in Ayurveda, we have this concept: after you eat food, you still have some feeling that I can eat more. That tendency to say no when you feel I can eat more, your ability to say no to that is so powerful, because that means you're giving space for good digestion to happen. So that space is very important. And the other one is when you can space your food in such a way that you're hungry on time and then you're eating on time, and especially at dinner. Let's say you're able to go to sleep by 10:30, and if you can finish your dinner by 7. This is one of the best hacks you can do for your mental health, for your gut health, for your overall physical vitality and mental vitality. So this is one thing, but people say, no, it's very difficult for me. I come back home very late at night. Maybe somehow, maybe you cannot immediately jump into the cold water and eat at 7 and go to sleep by 10:30. But see, what can you do so that you can redesign your home? See, whatever is priority to you, you'll always find a way to get it done. Whatever is close to you, you'll always find a way to get it done. So the only way, if you want to turn this around, is you have to realize health is my priority. Only when you make health is going to be my priority, you will find decisions to make that as your priority. If health is not my priority, let's say if work is my priority, then I will always choose work and career, even if my health is going to be at stake. So that's why I always tell, if you want to turn around your lifestyle, unless you make health as your top priority, you will always find excuses. Maybe I'll do that once I get retired, or when I really fall sick. Because once you fall sick, all the other problems will become irrelevant because health becomes your number one priority. So that's why don't wait till that time. Make health as your priority. And once you make health as your priority, you will slowly also redesign your life in such a way that you redesign your life, your family, your friends, your work in such a way that you can schedule your work, you can schedule your eating habits. So this will play an important role. So when it comes to acidity, I've seen patients who are eating very quickly. Sometimes they are eating a lot of junk, spicy food, and they are eating very late at night. This can lead to a lot of acidity issues. And also cutting down on alcohol and heavy sugary food, especially outside food. Very late at night, this can contribute to that. So I always take a full history of all the food habits that they, and then I slowly try to eliminate. Slowly, let's eat slowly. Let's chew the food properly, and don't be in a hurry when you eat. I've seen when people eat slowly and chewing properly, many conditions of bloating and acidity has minimized. And in some cases, just because of that, their gut health overall has a great improvement. But it varies from person to person. Sometimes there could be some patients come and say, I did a test and I have a H. pylori contamination. So what needs to be done? In those cases, you need a real medical consultation and take the protocol. Sometimes, what is the cause of this H. pylori bacteria to be infected? We need to also look into that. Is it from the food, or is it because the nature of your body's ability to fight these microbes are not healthy? Or multiple factors are there. Just by prescribing something that will kill the bacteria or the microbes, it is not a sustainable work. So we need to look at multiple things. And sometimes when people are anxious, that also leads to bloating. So dealing with the stress is very important. Now, there is this group of autoimmune conditions which also falls under the inflammatory gut disorders, which like irritable bowel syndrome. Sometimes, they have loose stools, or it can fluctuate from loose stools to constipation. Then you have ulcerative colitis or Crohn's disease. In these conditions, I've seen improving the quality of their mental health and stress coping mechanism and their diet, and maybe eliminating some things like milk or gluten or certain particular food is also playing an important role. So you cannot say there is just one tip for gut health. It's always a collective thing. You cannot identify just one part. So eating on time, eating healthy, and making sure you're hungry before your food so that you space, and avoid eating unhealthy food. And in Ayurveda, we have this concept. Make sure you get up in the morning after your previous night's food is digested. So there are two ways to look at it. So should I just sleep a lot in the morning? Or should I eat early in the night so that next day morning I wake up very well digested? So this also plays an important role. So that's why early dinner plays a very important role in your next day's performance and your productivity and your energy levels. So this plays an important role in gut health. Other than that, doing a panchakarma every now and then. When I say every now and then, it varies from person to person. Some people, if they can do a panchakarma once in 2 years, fantastic. Or once in a year, it is very good. But for some people with gut health, maybe panchakarma is not the right thing. Maybe doing retreats that will help them to improve their mental health itself will improve their gut health. Sometimes I have seen patients, just by improving the quality of their health, the quality of their sleep, their gut health has improved. So sometimes some people, when they move to a new location where the availability of their favorite food is there, sometimes vegetarians, when they go to a place where there's only meat is available, they struggle. They end up eating only junk carbs, and that makes it even worse. So when they don't have a good source of protein or macro and micronutrients, this plays an important role. So your surroundings and the accessibility also plays a role. And today you also see, because of the fast food delivery that comes to your home, this has also led to a lot of unhealthy hormonal changes because of the food people eat. Because this is giving you very quick food, and it's like very tasty, and you are feeding your cravings, and then this pattern keeps feeding on itself. And then when you eat certain food very late at night, this has a huge important contribution to hormonal fluctuations. Conditions like polycystic ovarian syndrome. A lot can be reversed just by correcting the food habits. And if you see some of the people, especially women, when they suffer with hormonal changes, one of the conditions that I ask them is, do you tend to eat outside a lot late at night? Or do you tend to order food deliveries late at night? Many of them if they live in a, let's say, corporate world, and they have to move out of their home, and they don't have the luxury to cook food at home, or they don't have somebody to come and cook the food for them, they end up ordering food from outside, and then that creates a lot of issues. So learning to cook or having a support system where you can have healthy food, investing that time and resources is so important. That way, that investment will save you by unwanted health bills that you might have in the later on. So this is some of the basic awareness that we can suggest for good gut health. Always look at the longer the shelf life of the food, not good. When you eat, always make sure you say no to that last portion where you feel you might get overloaded or where you feel overfed. Make sure after your food you feel light and you don't feel bloated and heavy. Make sure you're hungry on time and then you eat on time. Just by following these three, it makes a very important role.